Okay, so this is part two of my ranting and raving this morning of what the hell happened over the past couple of days. I mean, right now it's May 15th, 2026 for Friday in the morning. It is 3:35 in the morning. So I'm talking about what happened the past couple of days, how I freaked, panicked, went nuts, and been embarrassed about telling you people what was going on concerning about my foot surgery or potential foot surgery that needs to be done. But I can't do it because of a hell of a lot of pain, and I need to get general surgery done, which is putting me under so I can wake up and have the foot bandaged and I don't have to deal with the procedure because it hurts. And I was getting to the point where I was going to describe about my mother. My mother had endometrial cancer in the uterus, in the tubes. She had to have a complete hysterectomy. When she got tested by her doctor, and it was the same insurance company decades ago, she found out she had cancer. Now she already knew about the cancer history that we had in our family, and we had good relatives that died from it, including I had a grandmother who had cancer in the ear and had to have part of the lobe removed. My mother didn't want to die from cancer. She kept hounding the doctors. Had to change and change and change until she found one doctor that agreed, yes, she has to have surgery for the damn shit. And she had to push the insurance company to do so. They would be going through a slower way of maybe trying to handle this damn thing. But she wanted it out and quick. There was complications afterwards. They couldn't keep her in a nursing home. She didn't want to be in a nursing home. She wanted to stay at home recovering. I mean, for a couple of days after the surgery is one thing, but after that, she would need to be put into a nursing home or a recovering center and heal over there. No, she'd stay at home to heal. I would have a friend of mine do 24/7 on her. The living room became my mama's living room, actually a bedroom, while she healed up in a hospital bed. But the thing of it is, she fought the insurance company. She pushed the doctors. I have to find a certain strength about that one. I have to find allies in the insurance company to do this. If they're going to be cutting into me to get rid of this damn ulcer that had been on a slow heal for a hell of a long while, without, I need to push these guys to get this thing off my foot. But in a way I want it done and not in the office where they're going to be cutting me like crazy and it'll be a hell of a lot worse for me. This has to be done in an outpatient facility or a hospital. If I stay overnight, I stay overnight. But if it's going to be done within a few hours and I get to recover for a few hours after that, then I get to be home and hobble around, deal with my dog, I'll deal with my dog. But I am not having my foot sliced and diced open in a damn doctor's office without them having to care about the patient's comfort level or pain level that they have to tolerate. No, I refuse. Once was enough. Doing the initial clearing out of an ulcerous and dead tissue on my foot the first time because that was a major job. This one I'm hoping the guy isn't going to be a major job. But once they see this damn thing, then I'm going to tell them, look, you're not doing this again. You're not doing this again. Not. I want it done in a hospital. I want it done in an outpatient surgery center if necessary. Do I trust it? No, but I have to have it done because they will put me under. I don't want the local. I want the general. I want to sleep in the damn thing. I don't want to go through that pain level again. No inhale. No. Not this time. Not this time. Not about it. No, 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 no. I have to make this clear with them. But there's no way for me to do a video letter to send it over to their systems because they can't do YouTube. So now I have to wait and contact a certain case manager and let her know what's going on. Yesterday I was emotionally out of it. I couldn't even talk to you guys about this situation. I was embarrassed. I was ashamed that I didn't have the courage necessary to go through this damn thing again. I've been through this painful situations once enough as it is. I don't want to repeat the same damn experience. I was saying in the previous video about one particular procedure that I was trying to take care of situations I've been overdoing on my wrists, pounding keyboards for 20 some odd years, not doing it right, and developing pain from the wrist all the way over to the joint. And it was pain. It was repetitive motion. And I didn't do things right. So I was punching on keyboards the wrong way. And I had to go through electroconductive nerve study. I had to, for them to see whether or not it was nerve damage or just muscle damage. And it was muscle damage. And it was painful because they would find areas to shock and flip my hands, both of them, and then stab me with needles in certain areas. And I couldn't fight back. I had to keep saying the serenity prayer with my brother who was sitting right next to me, giving me other pain. Of course, I was pissing off the technician, I don't care. But he was helping me through the pain. I've got no one doing this for me. Regarding the foot situation, I got nothing. I was going to be bringing a teddy bear. A teddy bear to help me. Just the clutch heated further and further, tighter and tighter, as the pain gets worse and worse. And I'm thinking to myself, no! In the middle of the night, around 3 o'clock in the morning, or 1 or 2 o'clock, somewhere in that time period, right after midnight, I'm seeing it. I can't even sleep. I am so frustrated. I am emotionally screwed up. I am going nuts at this point over here. And I went, no! I'm not going through this damn thing again. I know it needs to be done. I don't want to be dying from other things happening and complications of the damn thing. I know it needs to be done. But I don't want to go through this particular round. If I have to fight, I have to fight. And I'm ashamed because I'm not brave enough. I'm not strong enough to deal with it like I did the last time. And nobody was walking with me on this one except my dog, who needed my attention more and more. But I have to do it my way. I don't want to die from a virus eating my flesh off. I don't want to die from gangrene where it's dying off the flesh. I want this damn thing healed. But in order to be healed, I don't want to go through the same lifelong pain that I got left and memories to be brought into heaven about how much I hate the doctors. Trying to heal me, they're trying to kill me at the same time. And I was so damn ashamed, so damn frightened, so damn scared and terrified. I couldn't talk to anybody about it until I started talking to my therapist. Actually, I didn't talk to a therapist about it. I talked to a priest about it. I had to tell him what was going on with me. I had to explain it to him that this was horrifying for me. That I had to do this to... I still got to talk to a therapist about it. I still got to talk to a case manager from my insurance company. I got to tell him what's going on. The grievance appeal will be denying my appeal. I probably won't even understand. Unless it's already happened to them and they can understand the pain level. I've been through a hell of a lot in my lifetime. I've been through medical situations that I shouldn't have survived, but I did. I had to live with lifelong pain after that. I had to deal with the psychological terrors. I had developed so much of a hatred, a fear, so much that anything that was going to be helping me, I said, forget it. I'll deal with it on my own. And what got me back into their fold was dealing with psychological issues, dealing with the grieving of all things. That I wasn't functioning after my mother's death, or trying to function after that. But when my brother died, it was like, oh my God, now what do I do? I mean, I had several psych appointments right after my mother's death, back in 2013. And I was taking care of my brother and having that having that going. My brother was having his own issues that was taking over the damn pain he had and giving him other pain. And me, I'm going to school and trying to take care of him and his shit. So yeah, everything was kind of whopper jobbed. Oh, doing great in school, but screwing up at home. But still trying to be my brother's caregiver at the same damn time. And then, he passes away. But then I had to get rid of his problem. But then I couldn't concentrate enough on schoolwork. COVID kicks in, puts me home. Now I got to deal with home situations. Now I got to deal with a dog who's aging slowly, going through dementia, barely walking around, but still struggling. Old, blind, deaf, with dementia. I stay home for another year or two. So I had to deal with the emotional stuff. I wanted to deal with the doctors on this shit. I started dealing with the doctors. I started dealing with shrinks. I had to talk to shrinks about what was going on. I developed the patient-doctor relationship and confidentiality stuff with me and a shrink, or therapist anyway, and dealing with the situation I'm going through. So it was comfortable enough for me to talk with him every so often to let him know what was going on and to guide me in certain areas. Kept doing my videos, kept doing audio recordings. I had to do something to keep my brain working, other than going to school. Even online, I was going to school, and I don't mind it. I'm still going through the collegiate. Being a collegiate. But for a while I had to deal with Mama. I had to deal with her situation. Next, my own personal health threatened because I wasn't taking care of my body correctly. I got the ulcer in December of 2025. On the foot. On the bottom of the foot. On the sole. It could have been on the top. Had to be on the bottom. But now I'm dealing with this. One damn thing after another. And this situation is putting me through a lot. I still want to go back to school. I still have to walk on the campus, but I probably won't. So I'll do the onlines. Okay, fine. I'll do the onlines. I'm used to it. No problem. Do a lot of research. No problem. Now, my life is still threatened because of the decisions I made concerning about my own damn health. Had an ulcer, had to be surgically removed in a doctor's office. And that is giving me the hell right now over it. I can talk to therapists about it. Over the past several months, I've been talking to therapists about the damn thing, including a case manager or two over it. But I still got to make that decision for myself on how I'm supposed to be handling my health. I've seen how my family tried to deal with it. It's my turn for me. I mean, seriously, at this point. I'm 60 years old. I should have been handling my health a long time ago. Actually, I think I had been. But not in this situation that I'm in where it's life-threatening. I'm just not blindly rushing in saying, yes, surgery, I mean now, please, I'll deal with the pain. And then realizing what the cost is. They want to keep me alive, but they're going to be putting me through a hell of a lot of pain, mentally and physically. That I'm still going to be dealing with the repercussions afterwards. I understand the immediacy. I understand the urgency of the damn thing. It's scaring the shit out of me. And I understand about if I happen to start getting infections, I have to get it treated. Which means probably IV needles sticking in my arms again. And dealing with bags of IV and then dealing with a pill regime. Okay, no problem. I'll have to deal with that. I'll have to deal with the pill regime of maintaining my blood sugar. Maybe with or without getting stabbed. Just pay attention to what my body's been trying to tell me if I can listen to it. But you are not putting me through a damn debrider. You're not putting me through a damn curved scalpel. There are consequences on this one. You're not slicing into me and just think that's going to be it. because you just already caused pain and problems for me afterwards. No, I gotta fight. I have to fight. I gotta be angry about this damn thing. I gotta be furious about this one. Not just at me for putting myself through this damn shit, and I can blame myself real damn good over this damn shit. No, what I need is I need to fight for my own damn health of being healthy enough down the road. I gotta make the choices of that. Yes, but this particular situation of surgery needed. Surgery is needed in an operating room where a patient's put under. I need that. I don't want it, but I need it. Because I am not going through the same damn procedure like I did through the damn podiatry office, just sticking my foot out there and getting through this damn pain, which damn near killed me the first time. And no damn teddy bears aren't going to help me out through this shit. I'll be ripping the son of a bitch out with my teeth if I have any left. Or just with my arms just ripping them because of the damn pain level. I'm not exaggerating. I'm not exaggerating. Because it was that level. Or do you want to reach out and murder the person who's doing it to you? I did say the M word. I did say the M word. But nothing happened. Not that time when I had to be surgically done out of my foot. Oh, when I had electroconductive nerve study, I wanted to do that to the technician who was doing it. Just, Nelly Willie, I'm just getting this thing. My brother's right next to me. He's my anchor. He's my rock. I'm holding on to his ass for dear life at this point. Because I didn't want to throttle the other son of a bitch. Because in my head, my nerve endings were telling me fight or flight. I'm not going through that again. And yeah, I labeled myself as a coward yesterday, and I put myself through an emotional headlocker in this one. That I wasn't able to get it to you guys to let you know what was going on. Because I was ashamed and I was afraid of saying this stuff to you. I had to get this off my chest this morning. And I still need to make the appointment with these guys. I hope it's not going to be too late. But I got to get these guys on the level. I need outpatient surgery. I need to be put under. I need to be sleeping through this damn shit. I am not going through the same damn shit awake. And if it costs the insurance company a great deal, if I had to get through authorizations through Medicare, Medi-Cal, whatever else it is, I have to. I'm already stuck with other financial situations that are burning me like crazy. Way more than what I can deal with. But I gotta deal with this one. I got no choice. My life's on the line. Short as it is right now. 60 years old. And I gotta fight for it. What's left of it. This is what's happening to me, guys. This is what's happening to me. I needed to get this off my chest. I needed to tell you guys what was going on because this was important to me. Very much so. I know about the political crap happening these days, and I'm not trying to get into it because right now Donald Trump doesn't give a shit. And I don't give a shit about him right now. They can talk. Other people can talk about MAGAs and everything else like that. I'm in a fight for my life right now. This is the priority. This is my battleground. This is what I do. This is what I'm dealing with. So, that being said, guys, for both videos,